Shani, we are starting the synovitis. Introduction. Synovitis happen when the synovial membrane or fluid inside is damaged, irritated. The affected synovial membrane swells up, thickness, and causes pain. Other symptoms inside your joint. The most common joint affected synovitis include your knee, hip, shoulder, elbow, and ankle. Then discuss the definitions. Definition: synovitis is swelling, inflammation in the synovial membrane that lining some of your joint. Arthritis and injury to joint are the most common causes. And causes is joint symptoms of the synovitis is joint pain, swelling, warmth, stiffness, trouble moving a joint. Then causes of the synovitis. Then rheumatitis arthritis, psoriatic arthritis, gout, overuse of syndromes, repetitive strength injury, infection, then sport injury, trauma like falls, car accident, autoimmune disorders, allergy reaction. Then risk factor of the synovitis and people with arthritis, people with autoimmune disorders, athlete, people who do manual labor. Then diagnostic of synovitis, physical examination, medical history, X-ray, ultrasound, MRI, joint expiration, then blood test, synovial biopsy. Then we are discuss the treatment of synovitis. The firstly anti-inflammatory medications. The non-steroid anti-inflammatory drugs for use that reduce the pain and inflammation. Then next corticosteroid used for either orally or injectable to provide the rapid relief from the inflammation. Then disease modified anti-rheumatic drugs for chronic condition like rheumatoid arthritis. Rest and joint protection to avoid activities. Then strength, then affected joint to allow for healing. Physical therapies, stretching, strength, exercise to improve mobility and function of the joint. Splint and brace supporting the joint to restrict movement and promote the healing during the acute episode. Joint expiration, draining excess fluid from the joint if there is significant swelling to relieve the pressure and pain. Biological therapy, then biological therapy targeted medication that modified the immune system to reduce the inflammation used to autoimmune related synovitis. Then surgery and rare cases, some cases surgical intervention may be required, include joint cleaning, arthroscopy, joint replacement. Then last more lifestyle modification, diet change and weight management to reduce joint strain, especially for weight bearing joint like the knee. And thank you over the class.